Osmotic pressure is a measure of the force required to prevent the flow of solvent from a solution with a lower concentration to a solution with a higher concentration through a semi-permeable membrane. It means that the more concentrated the solution is, the greater the number of solute particles and the higher the osmotic pressure. It is important to note that osmotic pressure depends on the number of solute particles and not on their chemical identity. This is an important point to remember when formulating dosage forms. When it comes to sterile dosage forms, it is also important that the formulation has the same osmotic pressure as the body's fluids. This is known as isotonic. Tonicity is the difference in osmotic pressure between two solutions separated by a partially permeable membrane. There are three types of solutions with different osmotic pressures: isotonic solutions, hypotonic solutions, and hypertonic solutions. Isotonic solutions have the same osmotic pressure as the body's fluids and will not cause any damage or disruption to the cells. This is why isotonicity is a critical characteristic of a sterile dosage form. Otherwise, if a solution is hypotonic, it has a lower osmotic pressure than the body's fluids. If a solution is hypertonic, it has a higher osmotic pressure than the body's fluid, which can cause cells to shrink and dehydrate. Moving on from solution to tests of parenteral dosage forms, I'm going to quote from the US Pharmacopoeia. Parenteral drug products include both injections and implanted drug products that are injected through the skin or other external tissue, or implanted within the body to allow the direct administration of the active drug substances into blood vessels, organs, tissues, or lesions. There are three different types of quality tests applicable to parenteral drug products: universal quality tests, specific quality tests, and quality tests for specific dosage forms. Universal quality tests are tests that are applicable to a wide range of products, regardless of their dosage form or active ingredient. These tests are used to evaluate the quality of the product as a whole, rather than specific aspects of the product. For example, identification, assay, impurities, foreign and particulate matter, sterility, bacterial endotoxins, container content, packaging systems, container closure integrity, and labeling. Specific quality tests are tests that are intended to evaluate specific aspects of a product, such as its active ingredient or a specific component of the dosage form. These tests are typically used to evaluate the quality of a specific product or product line. For example, uniformity of dosage units, vehicles and added substances, antimicrobial preservatives, water content, aluminum content, completeness and clarity of solutions. Quality tests for specific parenteral dosage forms are tests, universal or specifics, that are intended to evaluate the quality of a specific type of parenteral dosage form. These tests are used to evaluate the quality of products that are in a specific dosage form. And that's it for this session on the main characteristics of sterile medicinal products. We looked at safety, sterility, freedom from pyrogenic contamination, freedom from visible particulate matter, stability, compatibility, and isotonicity as 7 characteristics of sterile dosage forms. We also covered the role of osmotic pressure and tonicity, as well as the different types of solutions and the quality tests applicable to parenteral drug products. I hope you found it all useful and hope to see you again soon in the Scilife Academy.